You know, when we think about taking care of our hearts, our minds usually jump straight to two things: diet and exercise. And look, those are absolutely essential, for sure. But what if I told you that's only half the story? Today, we're going to dive into the full picture, the 4 pillars you need for a truly healthy heart, and it's all based on some pretty powerful new research.
First things first, let's just clear the air on a huge misconception. We tend to frame heart disease as this thing that happens way down the road, right? It's a problem for our parents' generation or our grandparents. But is that actually true?
Well, the hard truth is that belief is one of the most dangerous myths out there. Thinking you can put this off until you're older can have really serious consequences. Because the reality is, your heart health isn't something that just starts in your 50s or 60s. The foundation is being built right now, today, no matter how old you are.
And this is the number that should really make us all pause. The American Heart Association tells us that nearly 1 out of every 2 American adults, starting at age 20, already has some form of cardiovascular disease. Let that sink in. This isn't some far-off problem. For millions of us, it's a right-now problem.
Okay, so with the stakes that high, where do we even begin? Well, we start with the foundation, right? The 2 pillars everybody knows about: diet and exercise. They are the absolute bedrock of a healthy heart. But there's so much conflicting advice out there, so let's just cut through all that noise and see what the strongest science actually tells us. Let's start with diet. If you had to bet on one single eating pattern, the one with the most high-quality, robust evidence for protecting your heart, what would it be? The answer itself might not surprise you, but I think the strength of the evidence really will.
Yep, pretty much all the science points overwhelmingly to the Mediterranean diet. And what you see here is what it's all about. This isn't some crazy, restrictive fad. It's a way of eating that's loaded with great stuff. Extra virgin olive oil, tons of vegetables, fruits, nuts, whole grains, and getting more of your protein from fish and poultry instead of red meat. And here's the proof in the pudding. The Pre-to-Med trial, which is a huge deal in the world of nutrition science, found that this style of eating cut the risk of having a heart attack or a stroke by about 30%. To give you some perspective, that's a more powerful protective effect than many medications that are prescribed for the exact same reason. This isn't just a nice idea. This is proven, powerful stuff.
All right, so that brings us to our second foundational pillar: exercise. We all know we should be doing it, but the big question is always, what's the minimum effective dose? You know, how much do you really need to do to make a tangible difference for your heart? Thankfully, the American Heart Association gives us a really clear target. They say we should aim for about 150 minutes of moderate intensity activity each week. Think of a brisk walk where you can still hold a conversation, but you probably couldn't sing a song. Or if you're short on time, you can ramp it up to 75 minutes of vigorous activity, like jogging. The key isn't killing yourself in one workout. It's about being consistent all week long. Okay, so we've covered the big 2. Now let's get into the pillars that are just as important, but are so often ignored. And we're gonna start with sleep. We tend to think of it as just passive downtime. You know, our body's just shutting off. But in reality, sleep is this incredibly active period of repair and restoration, especially for your heart and blood vessels. I mean, we all have a bad night of sleep here and there. It makes you feel foggy the next day. But what about the cumulative effect? What happens when those bad nights start turning into bad weeks, or bad months, or even bad years? How does that long-term pattern of sleep really impact your heart? Well, a really fascinating, large-scale study followed adults for 7 years to answer that exact question. And they didn't just look at a snapshot of one night's sleep. They looked at the trajectory, the pattern of sleep habits over that entire time. And what they found is a huge piece of the puzzle. First, they looked at duration, just plain how long people slept. And what they saw was that the people who consistently got too little sleep over those 7 years had a 36% higher risk of developing heart disease. It just goes to show you, chronic sleep debt isn't something your body just gets used to. It really truly takes a toll. But here's the real bombshell from that study. It was sleep quality that was even more important. People with consistently poor quality sleep, you know, tossing and turning, waking up a lot, had a massive 55% higher risk of heart disease. And get this, that was true even after they accounted for things like diet and exercise. It just makes it crystal clear that 7 hours of restless sleep is nowhere near as good as 7 hours of deep, restorative sleep. And that leads us perfectly into our 4th and final pillar: stress. For way too long, we've kind of treated mental health and physical health like they're 2 totally separate things. But
The science is now just undeniable. Your mind, your thoughts, your stress levels, they have a direct biological line to the health of your heart.
So this leads to a really interesting question, and I know it might sound a little out there to some people, but can a practice like mindfulness, something that's all about managing your thoughts, can it actually improve the physical way your heart muscle works? Let's see what the data says.
So check this out. An incredible trial from 2022 looked at this exact question. They took patients who had just recently suffered a heart attack. Talk about a moment of intense physical and mental stress. And they had one group go through a program called Mindfulness-Based Stress Reduction, or MBSR, on top of their normal cardiac rehab.
And the results were just remarkable. As you can see, the group that did mindfulness had a huge drop in their anxiety scores. But it wasn't just a feeling in their heads. Their hearts were physically pumping better, that's what LVEF measures, and they had fewer complications overall than the group that only got standard care. That's about as direct evidence of the mind-heart connection as you can get.
So, there we have it, our 4 pillars: a Mediterranean diet, consistent exercise, quality sleep, and stress management. The big question now is, okay, how do we actually put this all together in a way that works in real life? It's not about being perfect, it's about integrating these things into a system. Here's a really simple way to think about it. As a 24-hour cycle, you start by fueling your body with those good, whole, Mediterranean-style foods. You carve out just 30 minutes to get your body moving. You take just 10 or 15 minutes to intentionally de-stress, maybe with some mindfulness. And then you protect those 7 to 8 hours of quality sleep like it's the most important job you have, because that's what gets you ready to do it all again tomorrow.
And really, that's the bottom line. It's all connected. You can't out-exercise a terrible diet, and you can't undo the damage of chronic stress or bad sleep with just a few healthy meals. True, lasting heart health comes from the synergy of all 4 of these pillars working together day in and day out. So I'll just leave you with this one final thought. Your heart never, ever takes a break. It's working for you 24/7. It beats over 100,000 times every single day. The real question we have to ask ourselves is our lifestyle doing the same for it?
Thank you for being here with me today. Remember, small choices create big changes. Keep nourishing your health with love and consistency. See you in the next Vital Elixir video.